You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of minimally invasive facial rejuvenation. With us, we have Beverly Hills cosmetic dermatologist that everyone is talking about, probably the busiest in California, big celebrity following. You don't want to miss what he has to say. So if you're not happy with the way you're aging, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of minimally invasive facial rejuvenation. With us, we have Dr. Simon Ourian. Dr. Ourian, welcome to the program.
Good to see you again.
Now, we've had you on the program before.
Yes.
Now, you're
Thank
the
you for having me.
busiest guy in LA, maybe even in California, when it comes to these minimally invasive procedures. Is that right?
That's right. I'm very proud of that. I started 10 years ago, and things just got better and better. We got
The number one
fortunate.
Botox guy, is that true?
It's true. We started 10 years ago, and we got very fortunate. Patients referred their friends, and they kept coming, and celebrities started coming, and one by one, they sent their friends and the celebrity friends and their
You see a
regular
celebrity
friends.
every day, I've been told.
Probably every
Just
day,
about.
yes, but we treat everyone like they are a celebrity. To me, everyone who sits in my chair is a celebrity, and it is my job to give them the best result possible.
You say you don't watch
For-
TV, so sometimes you don't even recognize them?
A lot of times I don't. I know I've seen their faces, but I don't know their names. My staff come back and they whisper in my ear, "You know who that is?" I'm like, I
All right.
guess I know. In reality, I like that fact. I like the fact that I treat everyone like they are a celebrity, and they could turn out to be a celebrity. There are times that sometimes you can't tell. They just come in ragged clothes and they sit down, and because they don't want to be recognized. I do my work, and later on I find out they were famous.
Okay.
But I do the same work for them as I do if I didn't know them at all, and that's what I would like to.
But you get everyday people. I mean, who is your typical patient? I guess it's not just for the
Our
rich and
typical
famous
patient
anymore.
is because of the fact that nowadays cosmetic dermatology is so amazing. You can do a lot with it, and you can actually make a person look younger, look better, look fresher in only a few minutes without major downtime, without pain, and with very minimal cost. It is for everyone. I have people who are employees of a supermarket all the way up to celebrities and heads of states. There's no huge barrier because of financial background.
So you get a lot of political people as well. You see them on the weekends.
On the weekends. On Sundays, people who can be easily recognized, and for security reasons, we have to see them on Sundays. But again, my job is one thing, to try to give them the look that they want, to look more refreshed, more natural, and especially for politicians and especially for celebrities, they want to look natural. Nobody wants to go out there and look like someone else. In fact, it becomes a huge ordeal. You can read it on the cover of Times Magazine if somebody gets too much Botox. There was a politician recently who had a little bit of a Botox was done irregularly. I didn't do it. So
The flat in the middle.
he had a flat middle, and the size of the eyebrows were going up, so he was looking like a sinister politician. That's not the look you want to have. In fact, it just basically ruined the whole campaign, and and you can take it down all the way to the person who wants to just look natural for her husband. That's the job that I want to achieve.
Now, one interesting thing, you know, we've talked off camera. You say that, and you know my age, that you say that if I start going to you now, that in 10 years, without surgery, that in 10 years, that I'll look younger than I do today. You believe that?
This is not just, I don't
But
just
you believe
it.
that?
I fully endorse it. I really think because of the fact that now the way medicine is moving, the way cosmetic medicine and aesthetic medicine is moving, every year we come up with something new, something better, and something more finely tuned. And if you take care of your face the way you take care of your body, if you take care of your face by doing minor procedures, nothing
Can
major,
you stop
no
aging?
Can
Can you stop aging?
Absolutely stop aging. At
The
least
appearance of
aging. Yes.
Okay.
We all age. I'm gonna grow older. My body's not gonna be the same. But you can stop the appearance of aging. You can halt it, and you can delay it for many years to come.
Now, as a cosmetic dermatologist, you think looks are very important.
It isn't just because this is my trade and this is what I do. Truly, there have been studies that have shown that if you're a better than average looking person, in many ways your life changes. You will have a better job. Your income will increase by 20% over your lifespan, which is more than if you had a master's degree. It's mind-boggling to just
Interesting.
not realize this. If you just look a little bit better, I'm not saying to be a superstar, to just look better than average, more doors will be open to you. Now, it is up to you what to do with those doors. But once the doors are open, you know, it's your personality, your training, your education, your knowledge. Those things will help you along the way. But to say that looks are not important or they don't play a role, I think is very naive.
Do you find that in slower economic times that people spend more money on themselves? I mean, is that true?
At least in my practice, I have seen this to be the case. When
Then why should you, by the way? Then?
Well, what happens is that when there's an economy takes a downturn, you still want to invest in something. Your home, if you invest more money in it, the value is not going to go up in the down economy. Your job, how much more are you going to invest in education? You're not going to get 2 years of education, but you can do a little bit of improvement in your appearance, and this is an investment in yourself. That will make you feel better,
because
more
you look
confident.
more vibrant.
You just look young, you know, whether you like it or not. This is a young youth society. And if you look better, you look younger, you look more attractive. I'm not here to endorse that. These are the realities. If you look better, if you look younger, you'll have better jobs, you'll have better relationships, people will be more attracted to you.
They perceive you differently.
They'll perceive you differently. And more importantly, you perceive yourself differently.
You say you see big changes, by the way, in self-esteem.
I've had patients, and I'll give you an example. Erica, she's around 50 years old, and she came to me and she said, I want to do something about myself. This is a year ago. And we did minimally invasive procedures on her, just a little bit of a Coolaser, a little bit of injections just to make her look better. And to me, this is what I do every day. So to me, this is everyday life.
All right.
She came back a year later, 6 months later, and she said, that little bit of change, which took me no more than perhaps 50 minutes of her life, changed her life dramatically. She went back home, she started looking at herself. A few days later, she looks younger. So she started to act like she was actually the way she did when she was 35. She
Really?
started to join a gym, go out more.
Just because you took care of her face.
It's amazing how your appearance will have the effect on your psychology. It is a reverse effect on your psychology. And for me to just sit down here and explain it to you, it is hard to believe, but there have been studies that have proven that if you look better, it's very easy to understand. You look better, you feel better about yourself, you become more confident, and you do better in life.
You like what you do. I mean, how'd you get involved in this? And why this area of medicine, cosmetic dermatology?
Number one, I've always been interested in aesthetics. I used to sculpt, I used to paint, but more than that, the way I got into this field was when I was 17, 16, 15. I always knew I had a crooked nose, I had a bad nose, and I had acne. Okay. And so I was, for good or bad reason, I was very introverted, I was shy. And
so you don't like your nose?
I didn't like my nose, and I didn't know how to fix it. I did know how to fix it, but everybody in my family, my parents, my relatives told me not to do it. When I turned 18, which was the legal age in California to go get your nose done without your parents' permission, I went and I got my nose done.
Is that right?
Absolutely. I got a nose job. I paid for it with my own money. Okay. And I got my nose done. And right after that, for 2-3 months later, once the swelling was down, it was like a new person came out. I was not shy anymore. I started to have conversations with people. I was outgoing. I was a better person to myself, not because of the way people were treating me, but my self-esteem changed. I really thought of myself in a different way. I saw myself in the mirror, and I really liked what I saw. And on top of that, other people started to treat me a little bit differently. They realized that I'm not shy anymore.
Do you think that was in your head, though? The people were treating you
maybe some of it is in my head. Maybe some of it was in my head, but some of it is actually we have certain understandings of how an attractive face is supposed to be. And frankly, my nose was crooked.
So it changed you.
It really changed my life. And I thought at that point, I really made my decision. I thought if I could go through medical school, through the training, and do this for one other person, I have done my work for my life. Because it really changes a person's life. You can go throughout your life, you can do a lot of things, but nothing is as profound as giving someone self-esteem for the rest of their life.
Do you see that in other people, by the way?
That
have that same type of reaction?
Every day. People come in, they don't even know what they want to have done. They say, you know what, I just don't feel good, or I want to look a little bit younger. Or they have ideas that, you know, I want to get rid of make my lips bigger. It is my job. I sit down with them, I explain to them what are the things we can do and what I think is going to help them to look better. And once we've had that conversation, I give them a menu. I say, this is like a buffet. You can choose from A, B, C, or D, or all of the above. But my job is going to be to achieve the results that they came in for. And almost a huge number of our patients walk in even after the very first time, looking and feeling better.
By the way, is it more women than men? It sounds like.
We probably have 70% women.
Are more
but
men
30% men, which is surprising.
What about
to a
age
lot
ranges?
of people. Age ranges, we start seeing people as young as in their 20s if they have acne or acne scars, or if their skin is not the way they want it to be, all the way up to 70s and 80s. But the majority of our patients are in their 30s, 40s, and 50s.
So you did some of your training at UCLA.
Yes, as important as it is that you get great training, and I always wanted to go, I did my training at UCLA, and then I did my postgraduate studies at Harvard. Those are great, but what really made me good at what I do is experience. Once I started my practice 10, 12 years ago, I started to see every single patient myself, and I did every single treatment day in and day out.
Are you a perfectionist?
You know, you probably don't want your husband or your father to be a perfectionist, but when it comes to your face, you want your doctor to be a perfectionist.
All right.
And that I am. I really believe that every face that I see, every time I work on your face, whether it's something as simple as a Botox or all the way up to a minimal invasive facelift, like a Coolaser, I'm putting my signature on your face, not literally.
So you do it all yourself for the most part?
Absolutely. I don't.
Is it true you do all your own Botox?
Every single treatment that I do,
even
every
Botox
treatment, I do myself.
Because you just don't like to train anybody else?
I don't. I have trained other people. In fact, we have a huge training seminars that doctors and nurses come from all over the world, and they do treatments, and they learn how to do these treatments, how to do them right, and learn about the art and the science of Botox and other procedures. But when it comes to my own patients, again, I'm a perfectionist. I like to do every treatment myself.
You like to do it yourself.
Yes.
Okay, now moving on to today's topic. Okay, the new technology. What's new? I mean, what are you using at Epion to make people look younger?
Randy, actually, if what is new today may not be new even 2 weeks from now.
Okay.
But when I get a patient to our office and when I sit face to face to them, I ask them what their problems are. And according to those problems, there is no cookie cutter approach to anything. We really want to find what is exactly bothering you.
Do you know, by the way, when you see them, do you say, oh boy?
I've been doing this for many years. I can
Like
look at a
15
person's
years,
face.
15 years?
15 years. I could look at someone's face, and within a second, I can tell you what I could do to make them look better. And I know exactly what I'm going to do. But the process of explaining this to them sometimes takes 20, 30 minutes, and as long as it takes, I really want them to understand what they're getting themselves into and what the benefits are. And in most cases, I'd rather promise the moon and deliver the sun, so I'd rather give them fewer promises and really wow them once they see the results.
So Coolaser, your favorite,
yeah,
of all the lasers.
Think of your skin as a shrink wrap, as skin that has gone too much. You have too much skin for your face. The pores have gone larger. You have discolorations, sun damage. You have wrinkles because you have extra skin around your eyes. You have wrinkles. You have sagginess here. And what the laser does, think of it as a blow dryer or a shrink wrap. It causes your skin to tighten up. And because of the fact that it only works on the stem cells by activating the stem cells to produce no collagen.
Is it through heat?
It's just kind of like it's the jolting of your skin to remind it of how to be healthy and young. Remember, our skin, even when way into our 80s and 90s, until you're alive, you have the map, you have that blueprint in your skin. All we need to do is to jolt it again one more time. And this is the laser that jolts your skin into reminding it how to be youthful and how to be young again. And the rest, your body does it on its own. I just stand back and we watch your body does the work.
Is it a light? Is it a laser?
It's a laser. It's a laser. It's a laser because the fact that it penetrates deeper and stimulates the production of new collagen, it causes your skin to go back to that healthy, velvety look instead of the old skin that we have. When you're younger, you have no wrinkles, you have no discoloration, and you have no pores. And that's the youthful look we look for. But there are other treatments. There's no cookie cutter approach to all the aging process. Aging happens in different parts of your face, and there's no one treatment that does everything.
So what's the next
fantastic? I would also recommend for some people who don't want to have as much of a downtime, they could use Coolfrax or fractionated laser.
Coolfrax,
which is one step down, and fractionated laser.
Or fractionated laser.
They all do similar treatments. It's just a matter of how fast do you want to see the results.
So it's for sun damage,
sun
or
damage,
just aging skin?
Fine lines, sun damage, sagging of the skin, and draping of the skin.
When you look at the aging face, what are you looking at? And let's start from the top down, and what do you do?
As you age, the very first thing that you notice in people is that they start to get a little bit of droopy eyelids, the upper eyelids, the eyebrows go down a little bit, they get dark circles, they get discolorations, we all get pores get larger, fine lines, and all these treatments, all these problems can be addressed one by one.
But for brows, don't you need surgery?
No, you don't need surgery. If you wait long enough, you're going to need surgery. But the same concept, Coolaser, can lift up brows really nicely.
Coolaser.
Just enough so that you have a nice lifted brow. You can actually get rid of the fat pad around the eyes by just using Coolaser and ultrasound. If you have dark circles, I don't care how many lightening creams, concealers, camouflage you wear, no matter what you use, what I can do in less than 10 minutes.
So under the eyes.
Under the eyes, to remove the dark circles. I can remove your dark circles in 10 minutes, more so than all these creams and all these other treatments can do in 2 or 3 years of your life.
What are you doing?
I do two things. Coolaser, and I add a little bit of volume under the eyes using radiance or a dermal filler. It just lifts the skin up, gets rid of the dark circles. I don't care how old you are. There are people who are in their 20s and they have to conceal the dark circles. This is the only treatment that I know that I have been doing it for the past 5 years that instantly gets rid of.
And what about when I talk to a doctor, and I'm more confused than ever, and they say on my show, Randy, you don't want to put fillers under the eyes. What is your response to that? And why do you like doing it?
The correct answer is really you have to do it the right way. You cannot do the fillers under the eyes like it's a sausage, you're just filling it up. You have to do it slowly. You have to do it very, it has a finesse and it has an art to it. And you have to do it the way I do it. Is that first of all, I dilute the actual product to a degree that it becomes easier to inject. So, and I inject it in multiple different points. So I start from the top of the line and I go all the way down to your face. So it actually looks like you have a nice sheet over your face instead of a line. If you just put it under where you think the lines are. I haven't seen too many other doctors do it, but the way I do it and the way I have learned to do it from experience is that if you the way we age is not like you end up with a line right here. Your whole face ages. So in order to reverse it, you have to address every single point one by one. It's more time consuming.
So for the brows, a little bit of Coolaser. Let me get this right. And then under the eyes,
you do a filler and a little bit of a Coolaser. This is the most important part, that it has to be done right. Every day I get a patient who thought, well, this is easy enough. I'm just going to go to a doctor and get the fillers under my eyes. But they end up with a little bit of a ridge under the eyes that is not looking natural. I want people to come only when they want to look natural, they want to look naturally better, like the way they did 5-10 years ago. Or as though
Can
they just
you do that, by the way, with minimally invasive? I mean, what's...
Absolutely. I do it every day.
10 years younger?
Every day, Randy. We do every day.
Can we say that on this show? And people need to know, this is not a scripted program. This is a real interview. But can you, I mean, you have this concept of stopping the aging process or slowing the aging process.
I can do two things. I can slow the aging process, and we can stop the appearance of the aging process on your face. If you look younger, you're going to act younger, you're going to feel younger, and you just get older later.
Is that right? Now you say that by getting procedures done, you give them leverage to start taking better care of themselves.
In a way, you're just opening new doors for people. If a person who is looking better, not only other people respond to you differently, studies have shown that your immune system gets better, stronger, just by looking better, by just feeling better about yourself. So you become healthier. In my opinion, you can have better opportunities in your life, and I think life becomes a little bit, just a little bit better.
Okay, we're going to take a quick break. We come back, more about the other technologies that you have in your practice. Absolutely. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with cosmetic dermatologists, in fact, LA's hottest dermatologist, and we're talking about slowing or stopping the appearance of aging with minimally invasive techniques. We'll be right back.
Tried all sorts of cover-ups for bad breath? Try the science of BreathRx. Only BreathRx has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreathRx from your dental hygienist and now at fine stores everywhere.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, new techniques to literally slow or stop the aging process, minimally invasive facial rejuvenation. LA's busiest cosmetic dermatologist, Dr. Ourian. Okay, now you are the busiest. Is that
probably
right?
one of the busiest in the country, yes.
Okay, big celebrity following, but you say everybody's doing this now. It's really mainstream.
The industry and the technology has become so advanced now that who doesn't want to look better? And every day we get patients who never thought they were going to do anything, but they start with a little bit of Botox here and they do a little bit of fillers here, and then all of a sudden they feel like, why not?
You know, when somebody walks around with great skin, it's almost like a credibility or a sophistication that goes with it. You know, they look healthy and vibrant.
Healthy, beautiful skin is healthy skin. And if you have healthy skin, it goes hand in hand with having beautiful skin, with having...
Do people say that, you know, I feel sexy again, I feel better, I'm getting looks now? Do they say this to you?
When you have beautiful skin, when you have healthy skin, you look sexier, feel better, you feel more attractive to other people. And it's not about just going out there and having a party, but the kind of attention you get from other people, the kind of response you get from other people, it just boosts your ego and you feel better about yourself. You become more sociable.
Is that right?
Absolutely.
And we're out of time just about,
Yeah.
and we haven't talked about facial fillers, things like that. What about intense pulse light? Is that out? Now that you have Coolaser and the new technology, intense pulse light?
Intense pulse light was from probably 6-7 years ago. There's still some room for it, but when you have new technology, when there are newer technologies that they can do the treatments in one session instead of 10-15 sessions, now most of our patients...
But I know people that swear by intense pulse light.
Absolutely, there's nothing wrong with that. But now most of our patients want something that's faster, quicker, and better results. So they move up to the next.
So one treatment on, let's say a Coolaser, would be equivalent to 10 treatments?
10 to 15 treatments of intense pulse light, and better, because intense pulse light doesn't do anything for the crepiness of the skin. It just basically gets rid of the spots and the redness.
But how does it tighten jowls, though? So you got a little bit of sagging, and it tightens?
As long as you don't have major fat deposit in your neck, which, by the way, we can take care of that with ultrasound. But as long as you don't have major fat deposit in your face, and it's mostly skin that's sagging, by shrinking the skin, by causing the new collagen fibers to become stronger, they just hold your skin better. It's just like having a million little ropes all around your face that pull your skin up and they tighten it up. That's how you are when you're younger.
Does it last for a while? How long does it last?
Anywhere from 3 to 7 years. I told you a patient of mine came 10 years ago, and she still looks better now than she did before the procedure.
But you get stuck doing this for the rest of your life?
Not if you don't want to. You only do it as long as you want to look better.
Is it true that the prices are about the same wherever you go? So you might as well look for a specialist.
This is the case. You know,
is that true?
It's very much true. Maybe with 10 or 20% up and down, the prices are very similar because most doctors have to make a living, and they all have to do something that most of their patients are happy with. The fact that it's very competitive pricing keeps the market very much level. But
I know RNs that do this, by the way.
Yes.
RNs, registered nurses. But to me, if with all things being equal, if the pricing is about the same, you might as well go to a doctor that's all he does or she does.
This is what
I ask patients.
This is how I feel about it too. If you're going to have the difference between a person who has learned how to do a few injections and a person who actually does this all day long is like a difference between a chef and a cook. You can have a meal prepared by a cook and it's going to taste really good once or twice, but if you ask them to make a little bit of a difference, then you're in trouble. You better go to a chef and ask for the meal of your life, and you have only one face. You want it to be done right. Insist on getting it done by the doctor, or at the very least, this is not what I endorse, but at the very least, meet the doctor who's in the office. You want to get treated by someone who knows what they're doing.
Are you getting better every month? This sounds like an obvious question, but I mean, are you at the top of your game, and do you feel that way?
I don't think I'm at the top of my game ever. Every day, I'm getting better and better and better. I think I know a lot more than I did a year ago, and I know a lot more than I did 2 years ago. So every day that I go back to the office, I learn a new treatment, and I tweak my treatments and my procedures to a way that it keeps getting better and better.
Now, if you're the busiest guy in almost all of California when it comes to Botox and the busiest center in Beverly Hills, how do you have time to see patients? Big line? I mean, as far as wait?
It's probably, we try to make it as seamless as possible.
Couple weeks?
We schedule, our waiting is usually, we try to keep it less than 2-3 months. So if you call and we try to get you in as quickly as possible, there is a waiting period for me to see you. But because the fact that these procedures are not life-threatening, you can wait a little bit and get good results.
Now, you know, people always ask me, you know, what should you look for in a cosmetic dermatologist or a plastic surgeon? And you know, I always say, you know, look for a specialist, but look for someone that does it all the time, because I mean, you're going to be looking at your face. You know, 50 is young today. You're going to be looking at your face for another 40 years. You better take it very seriously on who you pick to do anything to your face. At least that's my thought.
As wonderful as these treatments are, and as much of it great results as they make, the technology and the training of the doctor are only 20 to 30% of the actual result. The results that you're going to get depends on the doctor's experience and his artistic ability to create the results that he got trained for. And that's where you want to pick the person who really knows what they're doing. And you're going to, as you said, you only have one face. Make sure you invest a lot of time interviewing the doctor, find out what you're going to have done, and make sure you talk to a couple of patients that this doctor has had. And if the results are good, then you can trust your face.
So if I go in there and I said, I'm going to go visit you, how much younger do you think you could make me
Randy,
look? You know my age.
Yeah.
Because I don't feel like there's a big problem.
You already look younger than most people in your age group.
Okay.
But I think no matter what you come in for, I can do a little bit, few things that I could at least prevent you from getting older faster. I can stop your aging process, at least the appearance of your aging process, right at the age you are right now, and reverse
I'll put you
it.
on the spot. So you think, I mean, do you think
I could
you
probably
make
make you look 5 years younger.
5 years younger?
Yes, I definitely know I can make you 5 years younger.
All right.
Yes.
All right. Well, I want to thank you for coming on the show.
Absolutely,
Very
my
interesting.
pleasure.
Your
Thanks so
website,
much.
it's all there, all the before and after pictures, or some.
We have a lot of the before and after pictures. We don't like to put all of our patients' pictures on the website because with the technology the way it is, people don't like to be on the website every day. But if you come to our office, we have a lot of before and after pictures. There's a ton of before and after pictures. There's one face that you can identify with and you say, this is how I want it to look like.
All right. Okay, thanks again for coming on the show.
My pleasure.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.